Welcome to the video on specimen collection, taking urine from a Foley catheter. In this video, I'm going to show you the methods we use to obtain a sample of urine when your patient has an indwelling Foley catheter. If you look in your Clinitech Academy book, there's a page that goes over all of the steps for the indwelling catheter and also shows you the steps for collecting a clean catch when the patient does not have a catheter. So clean catch is on this side, indwelling catheter is on this side. So please refer to your book for these helpful steps. Like with any procedure, your nurse is going to delegate to you the task of getting the specimen from the Foley catheter. So my nurse has asked me to get a specimen from my patient, so I've gone to the supply room to gather my supplies. The things that you'll need for the specimen from the indwelling Foley catheter is this specimen collection kit. It actually says urine Foley catheter collect right here on the bag. Inside of this kit, you'll find 2 tubes, some alcohol wipes, and a transfer device. When you're looking for the expiration date on your supplies, you can actually just look at this yellow paper right here. It lists an expiration date, and that covers all of your supplies. In my kit, I have a gray tube and I have a yellow and red tube. What will normally happen is that the physician will first order a urinalysis for the patient. A urinalysis is basically an analysis of the patient's urine, and it can tell the physician a lot of things about the urine. It can also tell them if bacteria is present. However, it does not tell the physician what type of bacteria. So when a urinalysis, which goes in this yellow and red tube, comes back as positive for bacteria, the physician will then order a urine culture, which goes in this gray tube. And this tube tells the physician the specific type of bacteria that's present in the urine so they can order the appropriate antibiotics. So normally that process would be you gather one sample, it goes to the lab, it takes a little while, it comes back as positive. So a few hours later, you have to go in and get a second sample. ANOVA has made this process much simpler by saying anytime you're ordered to get a urinalysis, the red and yellow tube, you also get a urine culture, and this will go down to the lab and sit in the lab until this comes up as positive for bacteria and the physician wants to see the results of the culture. Then they'll run the urine culture. So that saves time, and it also saves the patient the time that it takes for you to collect 2 separate samples at 2 separate times. So they both come in the kit. When you're ordered to do a urinalysis, you always get a urine culture as well. So those are your tubes. We have alcohol wipes that we'll use to clean when we're collecting our specimen. And then in order to get the urine from the Foley catheter into one of these tubes, we use this urine transfer device. So you'll see that right here. So I've gathered all of my supplies. I'm going to bring them into the room. When I get to the room, I'll knock. I'll do my hand hygiene entering the room. And then I'm going to do 8-it. So I will acknowledge, good morning, how are you? I will introduce, my name is Teresa, I'm your Clinitech today. I will explain, I'm here to get a urine sample from your Foley catheter. I will give the duration. It'll take about 15-20 minutes. Is now a good time? And at the end, I will thank my patient. So my patient has given me the go-ahead to collect a specimen from their catheter. So the first thing that I'm going to do is I'm going to ask and verify to make sure that I have the correct patient. So I'm going to get my report sheet. I'm going to come over to my patient. I'm going to raise her bed up a little bit to make it easier on myself. Okay. And I'm also going to log into my computer. So right here, my computer is right next to the bed. So raising the bed up allows me to come to the computer and my patient is still safe. If my computer was not next to the bed, I would need to keep the bed in the lowest position until I came back to the bedside. So I'm logging into my computer and I'm going to ask my patient to state her full name and her date of birth. So I'm going to compare this to the wristband. So she said her name is Miriam Muhammad. I see that. And her birthday is December 7th, 1954. I compare that. And then I'm going to compare her MRN. I like to read it out loud because it makes it easier for me to catch if there's a mistake. 098, 098, 766, 766, 55, 55. So I've asked, insured, and verified my patient information. At this point, I want to grab this scanner from my computer. I'm going to scan her bracelet, beep, and this is going to pull up her information on my computer. So I'm going to go to my screen. There will be a screen where I need to verify her information. I click verify, and all of her orders come up. And what I'm doing here is I'm looking to make sure that the order the nurse has given me is also in the computer. I see that it is, so I'm good to proceed. If the order was not in the computer, I would have to stop what I'm doing and call the nurse and let her know. Maybe the physician would need to put the order in before I can draw the specimen. Okay, at this point, since I touched the patient, I'm gonna wash my hands. And I'm gonna prepare to do my sample. I wanna make sure I pull the curtain to provide privacy. All right, so Miss Muhammad, I need to pull your sheet back just a little bit so I can get to your Foley catheter. With this procedure, I only need to get to the port area right here on the catheter, so I don't need to fully expose her. I just pull the sheet back as much as I need. The first thing that I wanna do is empty the Foley catheter of any urine, and I wanna draw your attention right here to some dependent loops that we have in the catheter. So if you remember from the video that you watched about the urinary system, when the catheter has a dependent loop, it actually keeps the urine from entering into the bag, and it can back up in the bladder and put pressure on the bladder. So when I finish, I'm gonna make sure there aren't any dependent loops because I don't wanna cause the patient any harm. Okay. I'm gonna put some gloves on. And I'm going to empty the urine from the catheter into the bag. Now, the reason that I'm emptying it into the bag is because I want fresh urine that I'm gonna collect from a port right here. You never wanna collect a urine sample from the bag because that urine could be contaminated and won't give a correct result. So I'm gonna drain this urine into the bag. And once this is all in the bag, I know that my sample will be nice, fresh, new urine. So, after I've emptied all of the urine from the tubing, I'm going to take this green clamp and I'm going to bring it up here towards the port. I want it to be a few inches away from where the port is, and I'm bringing it up to eye level so that I can see this clamp and then I don't forget it later. I'm going to pinch my tubing, and I'm going to place this clip around the tubing. So what I've done right here is I've provided a kink that's gonna stop the urine from flowing into the bag so that I can gather all the fresh urine that is created by my patient. Once I do this, I have 10 minutes, no more than 10 minutes to collect my sample. The reason for that is if I go too long, I can cause urine to build up in the bladder, which could cause harm to my patient. Now, if I go 10 minutes and I see urine, that's fabulous. But if it's 5 minutes and I see urine, I can collect it earlier. The max time that I have is the 10 minutes. Okay, so at this point, I can cover my patient up while we're waiting for the urine. I'm gonna take my gloves off because now they're dirty. I've touched the urine tubing. I'm going to wash my hands and I'm going to prepare my supplies. So I have all of my things and I've set them on the bedside table. Before I set them on the bedside table, I make sure I clean the bedside table, I move any patient belongings so that my area is nice and clean. And actually, I did forget to mention, I bring in extra bags because when I send the sample to the lab, I'm going to double bag it. So I bring those in as well. So I have my tubes ready to go right here. And I need to arrange these in the order of the draw. So for collecting urine, I'm always going to collect the gray tube first. The reason for this is that there are different additives in my tubing. If you look really close to the gray tube, you can see there's some powder inside of it. And if you look close to this red and yellow tube, you can see there's some additive here on the side. And these additives allow my test to be run correctly and preserve the urine until it's time to run the test. These additives, if they get mixed incorrectly, can cause the test not to run accurately, so there's a certain order that I need to follow. Since the gray tube is for the bacteria, the specific bacteria, I want to make sure this doesn't get contaminated, so I always draw this first. So, gray tube first, then your red and yellow. So I'm going to set them up in the order of the draw on my bedside table. I'm also going to open my transfer device. I leave it in the package, but just take the paper off so that it's ready to go, and I will throw that away. I can move my bag out of the space, and I have my alcohol tubes ready to go. Something I want you to keep in mind about this transfer device is there's actually a needle inside of it. So this gray rubber colored thing is a needle. So just be careful, don't stick your finger inside of it, okay? All right, so if I look at the time, it's been about 10 minutes, so I'm ready to do my collection. So I'm going to wash my hands and put my gloves back on. Miss Muhammad, how are you doing? I'm getting ready to do your collection. I want to make sure in the 10 minutes that I'm also talking to my patient, putting them at ease and making sure that they're okay. All right, so I'm going to get my alcohol wipe and looking at the clock to make sure I'm cleaning for a full 15 seconds, I'm going to clean my port right here. And I want to clean this almost like I'm opening a jar to make sure that I get the tops and the sides. So I'm going to clean for 15 seconds. 5 seconds. 10 seconds. All right, there's 15 seconds. And now, since I've cleaned, I want to make sure that I don't let this port go, because if it drops and touches the skin, it will be contaminated, okay? The reason that I clean this port is because any bacteria that might be on the port potentially could get into my sample and give a false reading of, and then the patient might get the wrong antibiotic. So I want to make sure we're only seeing any bacteria that's actually in the urine, okay? So I'm going to take my transfer device and I'm going to place it on this port. So I push and twist, okay? And then I'm going to put my tubes in. So the gray tube always goes first. So I'm just going to push this in and it will fill up with urine. Once that has filled, I can take it out and set it on my bedside table. Then I will take my red and yellow tube and I will allow that to fill up. And I'm going to make sure that I allow my tubes to fill completely. Once that is finished, I will take that out. And now, the first thing that I want to do is take this clamp off. If you notice though, I'm still holding my port. I want to remember that I have 2 things that I need to remove, but the clamp comes off first because I have that time limit and I want to make sure I don't leave this on because it could cause harm to the patient. I have not removed my hand from here, so now I remember to take off my transfer device. I'm going to set this on my bedside table because my sharps container is across the room and I don't want to leave my patient unsafe, okay? So at this point, I'm just going to cover my patient up for a second because I want to come back over here to my specimen. All right, so I've collected my urine right here. And I'm going to go to my computer because I need to print my labels. But before I do that, I need to invert my tubes. So I have them in my hand, and both of these tubes get inverted 8 to 10 times. Okay, so that's a figure 8 pattern. 1, 2, 3, 4, 5, 6, 7, 8. All right, so I'll set those down. When I go to my computer, I want to take my gloves off because I don't want to contaminate my computer with my dirty gloves. All right, so I'll do my hand hygiene, and I'm going to come back over here to the computer. So on my screen, it lists all of the tests that my patient has ordered. So I see some blood tests in there and some other things. So what I want to do is uncheck any tests that I don't want and make sure that only the tests that I do want are selected on my screen. Once I do that, I'm going to click the print and my labels will come out. Now that I have my labels, I need to verify them for the give me 5, the 5 things that I'm looking for on each label. So I'm coming back over to my patient's bracelet, and I'm going to compare the labels to her bracelet, and I'm going to verify each of the give me 5 things for each label. So I'm looking at the patient's name. So I have Miriam Muhammad, Miriam Muhammad, Miriam Muhammad. I'm looking for the MRN. So I have 09876655, 09876655, 09876655. So those are my first 2 things. Then the last 3 things are related to me. I'm looking for the date and the time that I collected and my U number. So I'm looking again. Here's today's date, here's the time, here's my U number, here's today's date, here's the time, here's my U number. So I verified the give me 5 on each label. When I get ready to label, I also am going to look at the bottom of my labels because it lists the test name. So I have urinalysis, yellow and red, that I'm going to make sure goes on the yellow and red tube. And I have the urine culture, which says gray, which I'm going to make sure goes on the gray tube. So now that I'm ready to label my tubes, I actually need to put my gloves back on because I'm potentially coming in contact with body fluids when I pick up my tubes. So I'm going to wash my hands here and put my gloves back on. When I get ready to label my tubes, I'm going to look at the labels that I have here. And if you look, you have 2 small labels at the top and 1 big label at the bottom. The big label is what I use to verify my give me 5, and this is the label that's going on the tube. So in my hand, I have the gray label, so I'm going to label my gray tube. Now, for my urine specimen, both of my tubes, both the gray and the red and yellow tube, have certain specifications for how I label them. So this gray tube is pretty short. When it goes down to the lab, they're going to need to make sure they can see the patient's name when they put it in their machine that runs the test. So I need to get this label as close to the top of the tube as I can, okay? So normally when you label tubes, you are going to match your label up with the manufacturer's label on the tube. For this gray tube, I'm actually going to line my label closer to the top. And I also want to make sure that my patient's name is close to the top. So what I like to do is peel back these 2 short labels so that my big label kind of pops up and I don't have to use my fingers to pull it off. And then I'm still going to line it up with the manufacturer's label. I'm just going to put it close to the top of the tube. And then I can pull the little labels off and I can secure my label to the tube. So I have my patient's name towards the colored part of the tube, and it's up nice and high so the lab will be able to see it. Then I'm going to take my yellow and red label and label my yellow and red tube. Now this tube also has a specification for how you label it. If you look right here, you can see that there's a max line on the tube. The lab wants to make sure that they can see the max line. So when you put this label on, you need to put it just below the max line of the tube. So what I'm going to do is prepare my label, and then I'm still going to line it up with the manufacturer's label, but I'm going to line it up right below that max line. So when I put it on right here, you can still see the max line on the tube. Okay, so now my tubes are labeled. I can grab my tubes again and just verify one more time against my patient's bracelet that I have the correct patient, Mir Muhammad. I have the correct MRN, 098-76655, 098-76655. And then I'm verifying one more time. I have my yellow and red label on my yellow and red tube. I have my gray label on my gray tube. So I know I'm good with my labeling. Now, what I want to do is scan my tubes to make sure the lab knows that they're coming. But I have gloves on, and I can't go to the computer with gloves on, but I'm also going to be picking up my tubes, so I don't want to have two hands without gloves. So what I'm going to do is take one glove off, and I'm going to use this hand to hold my scanner, and then this hand can hold my tubes. I'm going to scan my tube, beep, beep. And then to finish out the entire process, I need to scan my patient's bracelet again, beep. And if I look at my computer, I'm gonna see everything is complete. And then I'm actually gonna take my hand that does not have my glove on, gonna use it to open my bag. I can drop my tubes in, put that down, take my other glove off, wash my hands. And then I'm gonna roll this up. I like to make sure the air is out. This bag is going to go inside of my second bag, because if the tubes were to open in the tube system, we won't want the urine everywhere. And then I'll put the little labels that came with my big labels in the second bag. This is now ready to go to the lab. At this point though, I'm actually going to finish up in the room, so I need to clean up all of my supplies, and I'm gonna show you how to empty the urine from the Foley bag, okay? So, my patient's bed is still in a high position, which is actually gonna make it easier for me to empty the Foley bag, and I'm close enough to my patient that she's safe, but to be extra cautious, I'm going to put this side rail up while I empty the Foley bag, just to make sure she does not fall, since the bed's in the highest position. So I'm gonna wash my hands again and put some gloves on. So how often do you empty a Foley bag? For one, the physician is gonna order I's and O's every so many hours. If you're in critical care, like the ICU, it might be every hour. If you're on a med-surg or telemetry floor, it might be every 4 hours, every 8 hours. So you'll follow that order. However, you also want to empty the bag when it's 1/2 to 2/3 full, because you don't want the bag to get too full. You're also going to empty the bag before you take the patient for a walk, before they ambulate, before they go to any sort of procedure, okay? So I'm gonna come over here to my Foley bag. I'm going to bring with me a graduated cylinder, a pad, and some alcohol, okay? I want to make sure that I don't get any urine on the floor, so I'm going to set the pad down on the ground underneath of the Foley bag, and I'm going to put my canister down there as well. Now, we talked about dependent loops earlier, so I want to make sure that I don't have any dependent loops in my patient's Foley catheter. So I'm just going to adjust the catheter, and I'm going to move this clip down here. And if I put the clip closer to the end of the bed, and I'll figure out how it works best with my patient's position. If I clip it onto the sheet right here, I'll have a nice straight line into my catheter, no dependent loops, no urine buildup. All right, so I'm gonna get down on the floor to the level of my bag, because I never raise the level of the bag up. It always needs to stay below the patient's bladder. And what I'm gonna do, I have my alcohol close by, but I'm gonna set that down on my table, is first, I'm going to unclip these green arms from the catheter bag. And then I'm going to aim my green spout right here into the canister. And the last thing I'm gonna do is unclip this silver clamp. So I want you guys to be able to see that. The way you unclip this is you actually push down on that little ledge, but you always wanna have it over the canister when you unclip, because as soon as you do, urine will come out. I don't have a good grip on there, let me fix that. All right, I wanna make sure that my spout does not touch the canister because I don't want it to be contaminated. And I'm gonna let all of the urine in the bag drain out. Okay, once that's all drained out, I'm gonna clip my silver clip back in place, and now I need to clean my spout. So I'm going to take my alcohol wipe, and looking at the clock so my timing is accurate, I'm going to clean this spout for 15 seconds. The reason I'm doing this is if any bacteria did get on the spout, I don't want it to be able to crawl into my urine bag, because then it can crawl up the tube into the bladder and cause a urinary tract infection. All right, so I've cleaned for 15 seconds, and I'm very carefully gonna clip this back into place here, and my bag is empty. At this point, I'm gonna take my urine canister, I'm going to put it on a flat surface. I'm going to get down at the level of the liquid to measure it. I'm also noticing the color, the clarity, if there's any smell, and my fourth characteristic is amount. I'm going to document those in Epic and also share them with my nurse. Then when I'm finished, I'm going to take this, dump it in the toilet, and I will throw this canister away because it's one-time use only. Okay, so I'll do that. All right, now I want to finish cleaning up my room, so I'll cover my patient up. I'm going to put my bed in the lowest position. I'm going to throw my trash away. I'm going to put my sharps in the sharp container. I'm going to make sure my patient knows her plan of care, go over the whiteboard. I'm going to go through my P's and Q's and just make sure my patient is completely safe. Once I finish all of that, I will take my specimen that I collected. I'm going to go to the tube station and I'm going to send it. So I want to show you guys real quick what the tube canister looks like, because I know some of you may not have seen that before. So when I go to the tube station, this is what I'm going to find. So if you've used the bank, you may have seen this. If not, the way you open it is you grab these red pieces right here and you pull and it will open up. Whenever I'm sending a specimen, whether it's blood, urine, anything, I want to make sure that the tube has padding in it so the specimen doesn't jostle around and potentially open. So I'll just put this inside like this, close it up, and then I will send it to the lab based on the number of the lab, put it in, and it will send away. And make sure the tube goes before you leave. Don't just leave it in the tube station. All right, so patient is safe, gone over the P's and Q's, gone over the whiteboard, put my sharps in the sharps, cleaned up the room. We're all set, so we're finished. So that is your video on specimen collection from a Foley catheter. Please watch this video and the Clean Catch video and refer to your book for the steps. Thank you.